this chapter, we're going to talk about ways to intraoperatively reduce your bacterial burden and therefore reduce your chances of infection. With regards to typical bacteria covered for shoulder surgery, cefazolin seems to be adequate for not only the typical bacteria, but C. acnes as well. The penicillins and cephalosporins show strong activity against C. acnes. Some strains are highly susceptible to clindamycin, and some strains are highly resistant. As mentioned before, despite typical surgical preparation and intravenous antibiotics, C. acnes is not eliminated completely. Using the preoperative techniques we described earlier, you can reduce the bacterial burden of C. acnes leading up to surgery. Certain measures can be taken with regards to the surgical setup to reduce your chances of infection. In a large study from the New Zealand Joint Registry, laminar flow actually did not show a reduction in infections, and in fact there was an increased revision rate in hips due to infections. Based on the currently available data, laminar flow is not necessarily recommended. Recent Cochrane database reviews regarding plastic adhesive drapes, whether impregnated with iodine or not, have failed to demonstrate any significant benefit compared to no drapes. In fact, positive culture rates are increased in some studies after use of the drapes. Based on this, routine draping of the surgical field is not recommended. However, draping out the axilla may provide some benefit and some protection against C. acnes contamination. In my practice, I choose to drape out the axilla only, leaving the skin prepped but not covered in plastic drape. One method of potential contamination involves gloves. Frequent changing of the gloves is advised to minimize the risk of contamination during surgery. Key points of the procedure, including after draping and before implanting the prosthesis, the gloves can be changed to minimize the risk of contamination. In my practice, all of my team members change gloves immediately after draping, and I change gloves prior to inserting the final implants. Based on current evidence, skin blades are contaminated after the initial incision. Because of this, I recommend changing your blade or using electric cautery for further dissection. It's no secret that frequent irrigation is known to reduce the bacterial burden. In a recent meta-analysis of staples versus sutures, staples showed an increased infection rate when compared to sutures. Topical adhesive style dressings showed a decreased infection rate compared to traditional wound closures. In my practice, I combine a subdermal closure with a topical adhesive dressing. In addition to potentially lowering infection rates, it provides excellent cosmesis. Finally, it's worth mentioning that silver-containing dressings can also reduce the bacterial burden and potentially the infection risk. In summary, there are a number of different ways that you can reduce the bacterial burden and therefore the infection risk in your patients during surgery. Despite our best efforts, infections can occur. In the next chapter, we'll talk about the diagnosis and management of those infections.